Welcome. Let's look at the aorta. The aorta is the largest artery in the body. It is like the artery of all arteries. They supply oxygenated blood and nutrients to body cells. We have the aorta from this region down to this region. So this is where they pass through. And of course, as they run through this course, it gives off branches to supply oxygen and nutrients to the different organs in the body. So going through this lecture, we would be unfolding the different branches of the aorta and also what they supply with oxygen and nutrients. So let's look at the origin of the aorta, and where they begin from is the heart, and the specific region of the heart where they emerge from is the left ventricle. So this is the general configuration of the heart highlighted in black. We know that the heart is divided into two compartments. We have the right compartment and the left compartment. In the right compartment, we have deoxygenated blood, while in the left compartment, we have oxygenated blood. And of course, we know that the aorta carries oxygenated blood. So definitely they would emerge in the left side of the heart. But let's look at the specific region of the left side of the heart where they emerge from. We already said that this is the left region, and we know that the upper part we have the atrium. In the lower part we have the ventricle. So this is the left atrium and this is the left ventricle. Oxygenated blood is being directed from the atrium down into the ventricle. In the left ventricle we have oxygenated blood from the left ventricle. The only vessel that will carry the oxygenated blood to feed oxygen and nutrients to the different organs in the body is the aorta, and this is the aorta. So this means that the aorta will emerge from the left ventricle, and that is the left side of the heart where we have oxygenated blood. So this is the aorta highlighted in red. To drive in more on the origin, just at the region where it emerges from the left ventricle, we have the aortic valve or semilunar valve. And this is what is presented in this image down here. So it's like a three-patterned leaflet configuration. And what it does is that as blood enters or flows through the aorta, it closes up and it tightens up against each other. What the aortic valve or semilunar valve does is to prevent backflow of blood into the left ventricle. Because if you see the pattern by which the aorta emerges, it emerges and it ascends up. And this kind of configuration suits backward flow. And the structure that is there at just the origin of the aorta is the valve. And this valve helps to prevent the backflow of blood into the heart, because the blood are not needed in the heart, but are needed to be supplied to the different organs in the body through the aorta. Let's look further to see the different regions that it presents after its origination. The different regions of the aorta are divided into three. So we have the ascending part. We say that immediately it emerges from the left ventricle, it ascends up, and the region where it ascends up is called the ascending aorta. And this is the ascending aorta arrowed in blue. After the ascending part, the aorta will arc over itself. And this region is called the arc of aorta, and this is the region I highlighted in green. After the arc, the aorta will then descend down, and as it descends down, this region is called the descending aorta, just as the name implies, because it actually descends down the body. The descending part of the aorta is further subdivided into two regions. So we have the thoracic aorta, which is arrowed red, and of course the thoracic aorta is the initial segment of the descending aorta that is seen within the thorax. Because this region passed through the thorax, is called the thoracic aorta. And more inferior to the thoracic aorta, we have the abdominal aorta, because this is the region of the descending aorta that is seen within the abdominal cavity. So the descending aorta, because it descends after the arc, of course, it descends through the thorax, and it also descends through the abdomen. So the region that descends through the thorax is called the thoracic aorta, and the region of the descending aorta that descends through the abdomen is called the abdominal aorta. And of course, separated by the diaphragm, which is highlighted in black. So let's drive into the ascending aorta. We already said that the ascending aorta is the initial segment of the aorta, and it is the region that is seen to ascend up. And this region only gives off a branch that is called the coronary artery. This is the coronary artery that is highlighted in red. This coronary artery is given off to supply the muscles of the heart. We already know that the heart, of course, helps to pump blood. Because it helps to pump blood does not mean that it does not have its own cells that it needs to feed So this is supplied with oxygen and nutrients so that they can also undergo their metabolic activity to generate energy so that the heart can effectively execute their action. So we have the right coronary artery and the left coronary artery. After the ascending aorta, we have the arc of aorta. And the region highlighted in green is the arc of aorta. This region tallies with the level of the sternal angle of Lewis, which is at the level of the T4, T5 thoracic vertebra. So on this region, we have the emergence of vessels. If you look at the arc of aorta, we see that we have three emergence. And this emergence basically are to supply the upper region of the body. And this includes the head and neck region and also the upper limb. Those are the regions that are seen above the arc. And of course, they need to also be supplied with oxygen and nutrients. So the arc decides to give off three emergence to supply these regions. The first emergence on the left, we have the left common carotid artery, and this is the left common carotid artery. Also on the left side, we have the left subclavian artery, and this is the left subclavian artery. This left subclavian artery will go to the upper limb, while the left common carotid artery will go to the head and neck region. You can see that they are already being positioned to supply the head and neck region and also the upper limb. So on the right side, we are supposed to have the same configuration on the right side, but that is not what is saying. The first emergence we have on the right side is the brachiocephalic trunk. And this is the brachiocephalic trunk highlighted in black. This brachiocephalic trunk, when we hear trunk in anatomy, basically there is a possibility of further division. It means that this brachiocephalic trunk will further subdivide into the right subclavian and also the right common carotid. And that is what is presented. So we have the brachiocephalic trunk dividing into the right common carotid artery and also dividing into the right subclavian. So at the end, we still have the common carotid artery and the subclavian artery on both sides. And of course, they are to supply the head and neck region and also the upper limb. So you can see how the aorta is supplying the different regions of the body. The common carotid artery on both right and left will further divide into the internal carotid artery and the external carotid artery. I have made a lecture on the subclavian artery, the internal and the external carotid artery. Please kindly go and check that up so as to know the different branches that emerge from these arteries. Also, let's add that around the arc of aorta, we have the ligamentum arteriosum. The ligamentum arteriosum is an embryonic remnant transformed into ligamentum arteriosum, and it is this region highlighted in white. The ligamentum arteriosum connects the arc of aorta with the pulmonary trunk. This is the pulmonary trunk highlighted in black. If you've not checked out my lecture on the events at the sternal angle of Lewis, please kindly go and do so. One of the events that we highlighted at the sternal angle of Lewis is the ligamentum arteriosum. So this ligamentum arteriosum, we said it connects the arc of aorta with the pulmonary trunk. The pulmonary trunk or the pulmonary artery, we know that all arteries carry oxygenated blood apart from the pulmonary artery. That means the pulmonary artery carries deoxygenated blood. And where it carries it from is in the right side of the heart. We already established that in the right side of the heart, we have deoxygenated blood, while in the left side, we have oxygenated blood. And if deoxygenated blood is released from the right atrium down to the right ventricle, it will be taken up by the pulmonary artery to the lungs, where it will be oxygenated before it is then returned back to the heart. So we have the ligamentum arteriosum connecting the pulmonary trunk that is carrying deoxygenated blood, connecting it with the arc of aorta. So it's also good to highlight this structure within this region because it is related to the arc of aorta. Also going further to see the different branches that would emerge from the aorta as we go down. After the arc, the next region is the descending aorta. And as the name implies, we already said that, of course, it descends down through the body. And as it descends down, it gives off a number of branches. So let's try and dive into this to see how this is unfolded. First, we already highlight that up here is the thoracic region, and inferior to the thoracic region, we have the abdominal region. And of course, the descending aorta will pass through the two cavities. And that is why we have the creation of the aortic hiatus on the diaphragm. There is a demarcation formed by the diaphragm. This is the diaphragm highlighted in black, and the thoracic aorta will need to pierce through it before it can enter into the abdominal cavity to become the abdominal aorta. So on the diaphragm, a hole is created to allow the passage of the thoracic aorta before it will now be transformed into the abdominal aorta. So there is a creation of this hole that is harrowed in white. The branches of the thoracic aorta that we have the visceral branches, which are branches that supply the organs or viscera that are contained within the thoracic cavity. And we have the parietal branches that supplies the wall of the thorax. So for the visceral branches, we have the bronchial arteries. The bronchial arteries are 2 on the left and 1 on the right, and they supply the lungs and also its surrounding organs, which include the trachea and also the pulmonary vessels. Then we have the esophageal artery. The esophageal artery is highlighted in blue, and it supplies the esophagus. But the specific region of the esophagus that it supplies is the thoracic part of the esophagus. We know that the esophagus is subdivided into 3 regions. We have the cervical part of the esophagus, we have the thoracic part, and we have a very short abdominal part of the esophagus. But the region of the esophagus that is being supplied by the esophageal artery is the thoracic region. Then going further, we have the pericardial artery. The pericardial artery supplies the pericardium, and we have the mediastinal branches, which supply structures that are contained within the posterior mediastinum. So you can see that these visceral branches have taken up each of the different organs within the thorax to supply them with oxygen and nutrients. Then going further on the parietal branches that tend to supply the walls of the thorax, we have the posterior intercostal arteries. And these arteries are 9 pairs in number in the posterior part. Also, if you've not checked out my lecture on the intercostal spaces, we talked about the posterior intercostal arteries. The posterior intercostal arteries are 11 in number, but the superior 2 is supplied by the superior intercostal arteries. The superior intercostal arteries are branched from the costocervical trunk, which is a branch of the subclavian artery. So the superior 2 intercostal spaces in the posterior part are supplied by branches from the subclavian artery. So they are supplied by another artery, while the lower 9 is supplied by the posterior intercostal artery, which branch from the thoracic aorta. So this is where they emerge from. So the inferior 9 posterior intercostal spaces at the posterior region of the intercostal spaces are supplied by the posterior intercostal arteries that emerge from the thoracic aorta. Then we have the subcostal artery. From the name, it parts below the 12th rib, and it supplies the anterolateral part of the abdominal wall. Then we have the superior phrenic artery. This superior phrenic artery supplies the upper part of the diaphragm. Phrenic means diaphragm. So if we have superior phrenic artery, definitely we should have an inferior phrenic artery. That is the way it is being established in anatomy. So let's look forward to this as we go further. Definitely the inferior phrenic artery will be seen as a branch of the abdominal aorta. So let's go further to also unfold the different branches of the abdominal aorta. So for the abdominal aorta, we already said there is a region of the descending aorta that passes through the abdomen, and it also has its own branches. And this can be divided into the visceral branches and also the parietal branches. Viscera, we've established that they supply the organs that are located within the abdominal cavity, while the parietal branches supplies the walls of the abdominal cavity. So let's see these branches. For the parietal branches, we have the inferior phrenic artery. Remember, we talked about a superior phrenic artery that is branched from the thoracic aorta. This supplies the upper part of the diaphragm. So we have the emergence of the inferior phrenic artery, which supplies the inferior region of the diaphragm. Then we have the lumbar artery. The lumbar arteries emerge to supply the posterior abdominal wall. Then we have the median sacral artery. This median sacral artery emerges at the posterior part of the point of bifurcation of the abdominal aorta. And what the median sacral artery supplies, the 4th and the 5th lumbar vertebra, the sacrum, and also the coccyx. Then talking about the visceral branches, we have the iliac trunk. The iliac trunk supplies the upper part of the GI tract. Then we have the superior mesenteric artery, which supplies the middle region of the GI tract. We have the middle suprarenal artery. The middle suprarenal artery supplies the suprarenal gland that are located on top of the kidney. And by now, we should know that when we have specificity in name, we should know what that means. For us to have a middle suprarenal artery, it means that we would have a superior suprarenal artery and an inferior suprarenal artery. The superior suprarenal artery will emerge from the inferior phrenic artery, where the inferior suprarenal artery will be branched from the renal artery. Then we have the renal artery that supplies the kidney. We have the testicular or the ovarian artery. If it is a male, it will be testicular artery, in female, it will be ovarian, and those are the gonadal artery. We know that this artery is also emerged from the abdomen because this is where they develop from before they descend down. So they also take in their blood supply along with them as they descend. So we have the gonadal artery also as a branch of the abdominal aorta. Then finally, we have the inferior mesenteric artery, which supplies the distal or the terminal part of the GI tract. So you can see that the visceral branches are already being programmed to supply the different organs or viscera that contain within the abdomen. Then let's look at how the aorta terminates after giving off branches in its thoracic region and also its abdominal region. At the level of the fourth lumbar vertebra, it terminates and divides into the common iliac artery on the right and the common iliac artery on the left. After bifurcating into the common iliac artery on the right and on the left side, we have further division of the common iliac artery into the external iliac artery and the internal iliac artery. The external iliac artery goes down to supply the lower limb, while the internal iliac artery goes into the pelvic cavity to supply the different viscera that contain within the pelvic cavity. So that is how they finally terminate. Then let's look at the clinical anatomy. We have aneurysm. Aneurysm is like an abnormal bulge or ballooning of the aorta, and this can occur in different regions of the aorta. So where it occurs in the ascending aorta, it is called the ascending aortic aneurysm. When it occurs in the descending aorta, specifically maybe in the abdominal aorta, it's called the abdominal aortic aneurysm, or even the thoracic aortic aneurysm. So it depends on the different regions where they occur. There's going to be an expansion or an enlargement of the vessel, and that is what is seen around this region. And when this occurs, it is asymptomatic except when it ruptures. Then we have the aortic occlusion. Occlusion is like narrowing of the lumen, and this is caused by thrombosis or embolus. When these structures are seen, they tend to narrow or reduce the lumen of the blood vessels. This is the normal configuration, and this is when an occlusion occurs. You can see that the lumen here is wider than this, and the quantity of blood, of course, that will flow through this will be more than this. And basic treatment is embolectomy or angioplasty. And these basically are procedures that are used to widen the lumen of the blood vessels so that more blood can flow through it. Sometimes surgical bypass grafting can be done to rescue the situation. So thanks for watching this video. Let's meet again.